Chai, my condom non burst. I don't know his HIV status. I don't know her HIV status. What can I do? Kai God, I got pricked by a needle. What can I do? Good afternoon, everyone. I am Pharmacist Cav, and today on Pharmacist Cav TV, we have a resident pharmacist at the Federal Medical Center, Makodi, my senior colleague, to answer all these questions that are asked at the initial stage and to throw more light on what PEP and PrEP is. Good afternoon, sir.
Good afternoon. Welcome.
Please,
Thank
sir,
you.
can you introduce yourself?
Okay, I'm pharmacist Yokoho Felix, and I'm a consultant pharmacist with Federal Medical Center, and specialize in infectious diseases, HIV in particular.
Okay. Thank you, sir. Thank you for honoring our invitation to be on Pharmacist Cav TV today.
Thank you very much.
Thank you, sir. So, not wasting much time, let's just dive straight into the business of the day. So, please, what is PEP?
Okay, PEP is a post-exposure prophylaxis. Post means it has happened after something, while prophylaxis means prevention. So it's in HIV language, post-exposure prophylaxis are drugs you give to a patient who had an exposure maybe to a HIV patient or to somebody who is maybe susceptible to HIV.
Okay, wow. Thank you very much for that answer, sir. So, sir, please, what is PrEP?
Okay, PrEP is pre-exposure. PrEP is PrEP, the short form. It's pre-exposure prophylaxis. So, as to say that the thing has not happened, is like you're preparing for it. Prophylaxis, as I said, is prevention. So, in the case of pre-exposure prophylaxis, we are talking of trying to prevent. In HIV parlance, we are saying we are trying to prevent someone from getting HIV.
Wow, wow.
Yes.
I feel like clapping right now. I feel like clapping.
Yeah.
Okay, thank you so much, sir. So, is there a timing for this PEP or PrEP to be used?
Okay, for the case of PEP, that's a post-exposure prophylaxis. You have when you expose, for example, I know my status, I'm negative, positive, negative, and then I had intercourse without condom, or maybe the condom burst with someone who I'm not sure of the status, or I know the status. Maybe I know the person is HIV positive. Then I'll go for post-exposure prophylaxis, and in this case, you have like 3 days to take post-exposure prophylaxis.
Like 72 hours.
Yeah, 72 hours. So after that, we cannot really guarantee that post-exposure will work. So you have like 3 days within that time you had the exposure. This covers even maybe a needle prick from someone you know this person is HIV patient and you had a needle prick like that too. You can go for post-exposure prophylaxis.
Okay, wow. So what about PrEP?
PrEP is in the case of having one. PrEP is taking both PEP and PrEP are taken by persons who don't have HIV.
Okay.
So let's make that very clearly. So in the case of PrEP, pre-exposure, the person knows that okay, I am preparing to meet that person that makes me at risk of contracting HIV. For example, I may have a wife who is on drugs, and then me, I'm not on drugs. Or maybe I have a partner, not necessarily a wife, who maybe I'm not sure of the status, or maybe I'm sure, but like that. So in the case of pre-exposure, you take the pre-exposure drug 7 days before you meet the susceptible person. So after 3 days, I mean the 7 days, when you meet that person, every day you have an exposure, you will take the drugs 30 days after. But if that risk is no longer there, you may not need to continue the drugs. While in the case of post-exposure, if you are taking it now, you also take it for 30 days. If in that process of taking it, you still meet someone who gives your exposure out again, you take it for another 30 days.
You start that day. You start counting from that day from day one
of the exposure. Yes.
Wow. Okay. Wow. Thank you very much, sir.
Yeah. Okay.
So how effective is this PEP and PrEP in prevention of HIV infection?
It's very, very, very effective, based on the studies and the records we have in a facility. This facility in Federal Medical Center is, I think, the second largest in the whole country.
Wow.
We have a patient base of close to 11,000 who are actively on drugs, and then we offer PEP and PrEP services. So these patients have accessed these services, and I don't think I've had any record of anyone coming back to say I took PEP and then there were issues or PrEP.
Wow.
So it's very effective.
Wow. This is really a very big one.
Yes.
This is really a very big one. Okay, viewers out there, you can hear. So please, probably when you have an exposure, you are susceptible to contacting any of these. Maybe the process of going to meet someone and then you don't know the person and the condom get burst. You have heard from the consultant what he said. So you just need to visit the nearest clinic, right?
Where they assess HIV services and you'll be sorted out.
Okay.
Whether you want to prevent or whether it is after an exposure. So you don't have any reason to panic. If you have a patient, a partner who is a HIV patient, it does not also mean that you avoid the person. You can marry. There's what we call discordant couples.
Okay.
One couple has HIV, the other couple does not have. And then there are even in cases where you must not necessarily even take prevention, in the case where one couple has and the other does not have. Because for all our patients, we have a test known as a viral load test, which will literally count the number of viruses in the patient's blood. You understand? The virus can hide in the bones and other places, but those ones don't disturb you. It's what is in the blood that is more important. So once the drugs work in the blood and we are seeing something like 0, in fact, we want a value not more than 50.
Wow.
In fact, it's 1,000 we want, but these days we haven't brought it down to 50, so that if you are getting above 50, you still need more counseling, and then we'll make sure you don't even go up to 100. We'll make sure that all our patients, 90% of our patients, are below 50. And the advantage of being below 50 of the viruses in the blood is that it means that patient is healthy and strong, and most importantly, that patient cannot infect another patient. So if I have HIV and my partner, my wife, does not have, and I'm taking my drugs as I should, and I have a viral load less than 50, it means it covers my wife. My wife does not necessarily need to take preventive drugs as much as my viral load is less than 50.
Wow. This is really interesting and mind-blowing. This is really interesting and mind-blowing. And I believe you viewers out there, you are learning a lot from this interaction.
Yeah.
So please, there's no we can talk about PrEP and PEP without mentioning HIV.
Yeah.
So what is I believe some persons have known, but for the sake of others that have not really known what HIV is. So please, what is HIV?
HIV still remains, as we all know, human immunodeficiency virus.
Okay.
Yes, as we know, there are so many microorganisms that cause this disease. Bacteria can give you typhoid, protozoas can give you malaria, fungi can give you skin infections. So viruses can give you measles, Ebola virus, coronavirus, uh, and then HIV. And as the names I'm even calling, you know that any of the viruses is more fearful. The world shakes.
Yes.
Ebola virus shook the world.
Yeah.
Measles shook the world. Polio shook the world.
Yes.
Recently, coronavirus is because of the
And
way
lockdown.
viruses act. Our systems have immune systems that helps us fight diseases. But in the case of viruses, they don't go fight our immunity. They rather use our immunity, get into our immunity, and use their immune cells to produce their kind. So that's where viruses are very dangerous. And that's why HIV and anything virus is a matter of public concern and it's always taken serious. The world shouts anytime there's a viral breakout.
Okay. So what is the difference between HIV and AIDS?
Okay, HIV is when the disease, you contacted the virus, then that virus can, if not curtailed, the processes that leads to it destroying your system gradually leads to the disease called AIDS, acquired immune deficiency syndrome. So by the time you get to AIDS, it means that you are full blown, the disease has taken all over. Like I said, viruses affect your immune system. In the case of HIV is even a little bit even different from other viruses. Like for example, in the case of measles or chicken pox, when you get chicken pox today, after a week it goes away and gives you immunity for life. HIV does not do that. It can enter your system, hibernate for as long as 20 years. Maybe an ordinary test will not even detect it, why it is being transmitting to other people. So eventually you may have HIV for 20 years, you don't even know you're transmitting it out. And then when it breaks out, it starts, affecting your immune system. And once it's is affecting your immune system, it uses your own immune system to produce more viruses. And it means that other little illnesses that your immune system was fighting, your immune system cannot fight. And then it leads to a breakout of so many diseases, which leads to what you call AIDS. So AIDS is the disease. HIV is the virus that caused the disease. AIDS.
Wow. I'm really learning. Yeah. So sir, what are the risk factors, or what are the things that predisposes one to getting this HIV?
All right. The major one is unprotected sex.
Okay.
Unprotected sex is a major risk factor for contacting HIV, especially if the other partner is infected and is not on drugs. Then you have other minor ones like needle pricks, using of sharps, using of the unsterilized clippers, like that can also predispose one to HIV infection.
Wow. Thank you very much, sir.
Yeah, come.
They say a white man once says that, shall let me not use the white man. They say there's a saying that prevention is better than cure. So, sir, what are the means that, what are the things that one can do or one can put in place to prevent one from contacting this HIV?
Well, in HIV parlance, we have the ABC of prevention. The A is the absence, that is absential. If is it abstention?
Abstinence.
Abstinence, yes, abstinence. If you are not married, it's better to keep yourself until when you are married.
Okay.
If you are married, stick to that one partner. Why the B is the B is okay, I'm forgetting it, but the C is use of condom.
Okay.
So you use a condom correctly. Don't when it bursts. Then the B, I'm trying to remember the B now.
I think if we can bring it down maybe when we can actually put it in the comment section.
Yeah.
Yeah, we can actually put it in the comment
The
section so
B
that
just
for
keep my
those, yes.
when it comes back, I will
Yes,
try to
okay.
remember
If
it.
he doesn't bring
Mm.
it, it doesn't come out the end of the interaction, we can put it under the comment section for you people to
Okay,
follow
B
up
is
on.
be faithful.
Okay, be
Yes.
faithful. Okay, it has
So
come
be
out. Okay.
faithful. So you have the ABC of prevention. A is abstinence if you are not married. B is be faithful
faithful.
if you are married.
Married.
While the C is use a condom if you have to correctly. And then we also have these services now, prevention and post exposure.
Exposure.
You understand? So you don't have any reason to really panic. HIV is like in your palms now. You can chew it and make sure you don't get it like that.
Oh, wow. That is, will I say that is a dead devil or what? Okay, moving forward. So is there a general advice you can give to my viewers out there?
Well, I think to some extent the knowledge gap in HIV has been bridged to some point because almost everybody is either infected or affected. There was a time when maybe HIV looked so far away from us, but now it's so near that if you are not infected yourself, you have close friends, relatives that are affected. And it has helped to demystify certain worries. And there was a time where even in this clinic, you come and you see almost that our patients are looking like they are dying the next minute. But if you come to our clinic on a clinic day, everybody looks robust, and we have patients who have encouraged others to take their drugs. We even have formed groups for these patients who are doing well, who are bold enough to encourage others who are not doing well enough. So the first thing we'll say is stigmatization. There's no need to stigmatize anybody with HIV. You can use the same toilet with someone with HIV. You can use the same cutleries with someone with HIV. As much as there's no blood on it, you people can live together. You can marry someone who has HIV even if you don't have, like I explained earlier. So what else? Someone with HIV can have twins, can have triplets, can have as many children as they want. It doesn't stop you. The drugs are so, they are tasteless. The side effects are very low. You just need to take once a day and you're fine. We believe with time, the science world will unravel the mystery and get us drugs that will take care of HIV forever. But for now, we have drugs that keep you alive. We have drugs that make you stay alive. We have drugs that can make you do anything you want to do and achieve anything you want to do. So if you are infected and you're a patient and you are on drugs, keep to the timing. Timing is very important. That time you choose, keep to it and ensure your viral load is less than 50 and you'll be good to go to anything. If you are not infected, do not discriminate someone who is infected. If you know one around you, encourage the person to take their drugs. Encourage the person to live a healthy lifestyle, and then the person will be okay and society will be better.
Wow, wow. Thank you so much, sir, for that wonderful advice.
Yeah.
And I also pray that one day the science will get to the level where this HIV, the drugs are being developed to permanently take care of the HIV virus. Okay, sir. There's something I've been in my practice. There's something people always do. So I say, let me just seek or ask for your own input or view.
Okay.
You see, down there, you see a lot of people coming. They'll be like, there's ampicus bicham or an antibiotic. Make I go. Let me just go and have sex, unprotected sex. They call it raw. Make I go raw, and then I'll just take ampicus bicham 2 capsules or take an antibiotic to wash my system. Do this thing have effects? Does it assist in or does it help in prevention of this HIV?
No, it doesn't.
Okay.
No, it doesn't. No, it doesn't. And I say it again, no, it doesn't. Because when you are taking ampiclus, Ampiclox is an antibacterial agent which is supposed to take care of bacteria. HIV is not a bacteria, it's a virus. So if the virus in your system, you cannot use a bacteria to fight a bacteria. You can't use an antibacterial to fight a bacteria. You can only use an antivirus to fight a virus. So it is a very wrong notion. It has, in fact, there is no connection anywhere. Ampiclox, Bicham, or whichever product cannot wash HIV from your system. Only an antiviral drug that has been prescribed to take care of post or pre-exposure can do that.
Teso, Mimido, Emeka, Mohammed. Me, I don't talk tire. You can hear from the consultant pharmacist what he's saying. Ampiclox Bicham antibiotics does not help in prevention of HIV. Oyo is your case, so those who have ears may they hear. Okay, sir. Sorry, I want to apologize. I think the introduction wasn't really very okay. I
Sorry.
took I took you backwards. Sorry, sir. So, pharmacist Felix, sir, is a consultant pharmacist at the Federal Medical Center. So I want us to correct that. Thank you so much, sir.
Yeah, okay.
Thank you for for accepting to be on Pharmacist Scout TV
Pleasure
today
is
to
mine.
interview and
Anytime.
enlightening us about this PrEP, HIV, and other ways to prevent HIV. Thank you so much, sir.
You're welcome.
Please remember to like, share, comment, follow Pharmacist Scout on all the social media handles: TikTok, Facebook, Instagram. Subscribe to my YouTube channel for more medical updates. Thank you so much. I remain Pharmacist Scout.
I'm your co-host Felix, pharmacist.
Please be healthy, stay safe. HIV is real. Take care of yourself, remain healthy. Thank you.
Bye bye.
Bye bye.